Hello, I'm Dr. John Tisdale, and I'm here to tell you a little bit about gene therapy for sickle cell disease. Now, sickle cell disease is a genetic disease, meaning you inherit it from your parents. And when you get a copy of the beta globin gene that's been misspelled in a particular way from both your mother and your father, you wind up with this disease that causes red cells to be very fragile because the hemoglobin inside can come out of solution and become very rock hard and not pass through the circulation. And this causes really horrible things, horrible pain, strokes, organ damage, and death at a younger age. So gene therapy has been an idea for this disease since the genetic defect was known, and it's been especially attractive since we know we can do bone marrow transplants to fix the disease. So we can take somebody else's bone marrow and give it as a transplant, and then you grow red cells that make a normal hemoglobin, and that makes the disease go away. So we've been trying to figure out ways to do this for years where we take a patient's own bone marrow, not a family member's bone marrow, and try to fix it. And the way we do that is called gene therapy. Gene therapy is simply, using genes to have some therapy, some therapeutic intent. And so what we can do in the case of sickle cell disease is take the patient's own bone marrow and add a copy of the correctly spelled gene and then give it back as a transplant. And we can do this with viruses from nature that we've turned into sort of like Trojan horses to go and put the gene into the bone marrow cell that we've taken from the patient and then give that back. And hopefully it's efficient enough that those cells now make a normal hemoglobin inside of red cells, and those red cells function normally. So the biggest risk to the approach is that the way we do the transplant, we have to give high doses of chemotherapy to clear the existing bone marrow when we give back this bone marrow that we've added the correctly spelled gene to. And so that leads to, a drop in blood counts, a susceptibility to infections, a susceptibility to bleeding because the clotting cells in the blood are also reduced. And we have to support the patient through that intense process for about a month. So most of the risks really relate to the fact that this is a transplant. It's a transplant of one's own bone marrow cells, but that constitutes most of the risk. Other risks include that the viral vector can land in front of a gene that's normally silent, can turn that gene on and cause problems down the road, like an overgrowth of those cells, even a malignancy. And while we haven't seen that kind of complication using this type of viral vector system, it is at least a theoretical risk. The benefits are that we can restore normal hemoglobin and have all of the horrible complications of disease sort of stopped in their tracks. There are certain things that are irreversible, like if a patient has had a stroke, that's not going to go away, but we at least anticipate that we will prevent any future stroke by fixing the bone marrow and giving it back. So those are the major risks and benefits. We only have short-term follow-up at the moment, but we do think that this type of intervention is going to be a one-time intervention and then be durable for life and allow patients to have a normal life really for the first time in their life, a life without disease.